All right, the last 5 by 5, and you are gonna love this, and then we're gonna go have lunch. Meet Greg Frank, who is the Director of Global Policy, I'm gonna say it right, Global Public Policy of Merck. It's been a long morning, so excuse me. Global Public Policy of Merck. And meet Jada McKenna, who is not only CEO of Mercy Corps, which is amazing, but I'm very proud that you're a member of the USGLC Board of Directors. So you ready? Okay, you're first, Greg. Okay, so Merck. Merck has such a long history of contributing to discovering vaccines and the development of new medicines, vaccines, fighting infectious diseases, and using technology, obviously, around that. But today we're seeing, as you all know and are aware of, this rising levels in antimicrobial resistance, AMR, and it's threatening. Very concerning, and I did not know this number before, but 1.3 million people have been killed per year. And so this is really a serious concern, but you're on it, and you are working on it. So tell us about the innovation work that Merck is doing for a solution for AMR and how AI is being a part of this. Greg.
Well, thank you, Liz, and thank you, everyone, for the opportunity to be here today. And I know we're standing between lunch, so we'll try to be as brief as possible. But first off, we
care about global health, and everybody cares about their health.
And in that mind, I think it's good to emphasize even more why we should care about drug-resistant infections, because you mentioned the 1.5 million people dying directly. An additional or a total of 5 million people are actually dying associated with AMR infections. And if you look at that number and put it in the context, that's the third leading cause of death right now. Are we all talking about something as much as we should? Most of those deaths are in low and middle income countries. 1 in 5 of those are in individuals under 5. You know, many of the global development goals we set for ourselves, sustainable development goals by the UN, many of them are going to be directly impacted by our inability or ability to address AMR. So I do think we should all be keeping in mind in our respective sort of theaters of war, so to speak, why this is a global health and a global development issue we should all care about. So when we think about what Merck is doing, as you said, we have a long history in infectious disease. 100 years ago, we were one of the first companies to mass produce penicillin during World War II, just outside of New York. And we continue that legacy today, and we continue to develop new medicines, both in animal and human health, to address a wide range of infectious diseases, not only for bacteria, but for viruses and others. And we continue that fight in AMR. We are early stage development for new products. We are trying to find ways to make sure these products are used appropriately, because when you use a drug, bacteria develop resistance, so everything has a finite lifespan, and we're trying to find ways to make sure these products are available where they need it around the world. But when we look at AI and the new technologies, this is less of an AMR specific problem, but more of a drug development and innovation problem. And we, as probably many other companies around the world, are really leveraging and exploring AI and machine learning to basically see how we can become more agile, more rapid, to really develop innovation. And when we think about what we have been doing as a company over the last few years, it's really forging partnerships, looking at how we can use AI to develop and speed drug development, finding new targets, developing clinical trials, but things that probably a lot of companies are using. How can we be better manufacturing? How can we manage all the data we're developing? How can we be better at our customer engagement or back office work? So I do think as we move forward, we're going to be really looking at that.
So one of the things that I'm going to talk to Jada about as well is partnerships. And one of the great partnerships you have is in this space. And you have an AMR Action Fund. And I want you to tell us about how this partnership is working with others, particularly in leveraging technology to really address this issue, and tie it into what we've been talking about all morning, about working in the developing world. You've already started talking about this, but how is it addressing some of these big challenges in the developing world?
Great. Well, I know I'm running short on time, so I'll give you the brief version. But the AMR Action Fund is a $1 billion investor fund that Merck was a $100 million investor with 20 other companies in to really help develop the best and the brightest of the antimicrobial pipeline, while we work with governments around the world to actually implement policies to help create more of a sustainable development. And the Action Fund has invested in a number of companies. There's a diagnostic company, Pattern Bioscience, that actually uses AI as a mechanism for diagnostics. And as you said, one of the core principles of the Action Fund is actually that access and appropriate use and equity are built in from the start. So it's not something you think about at phase 3, it's something you take in from the beginning. And we think that is critical, and we are seeing some of the policies that the Action Fund's trying to work on also take that into account. Make access front and center, not an afterthought.
So Greg, look into the future. 5 years from now, global health is a huge issue. We, just a few years ago had a global pandemic, and your work understands and takes a look at that. 5 years from now, how is AI making a difference in this space?
Well, first off, I think we're only going to see the benefits of AI increase over time. I really would argue that this is a huge potential. But I also think we should be looking at, there's a lot of things AI can help, and there's a lot of things AI can't help. And so we look to 5 years in the future. I'll be remiss if I didn't say the UN is holding a high-level meeting on AMR this fall to sort of commit member states on what more we could do.
Okay.
And while AI has a part, there's a lot of other things that we need help with. So I really encourage us to be thinking about that. And I think if we're successful there, the next 5 years will be looking bright.
Thank you so much. All right, let's thank Greg and Jada. Come on down. So we're about to talk about something very different, but equally as important is digital connectivity. Jada, this was shocking. 3 billion people lack access to the internet. So we're all on our phones. 3 billion people don't have. Even more so, 50% of the world doesn't have access to broadband, high-speed broadband. So that means the benefits that we all have and everything we've been talking about on the stage, they don't, particularly in the developing world. But enter Mercy Corps, yay. You are at the forefront of trying to solve this problem. Tell us about the transformational work that you're doing in taking the developing countries, emerging economies, and how you are helping bring AI to this problem.
Yeah, the gap is real, but it is so important that we address it because the technology, AI, has so many possibilities in terms of educating, advocating, helping communities access to markets, helping communities to develop resilience and to cope with things better. It also has the ability to help with cohesion. On the other side, we know it also has the ability to do the opposite and to be a force for evil and to really tear communities apart. So it's more important than ever that we make sure that people have access and that we engage communities. And then for us as aid and development actors, it's critically important for us to be leveraging this technology to do our work better, to be more efficient, to be faster, to be more effective. And we've already seen some great applications. So you're seeing the use of virtual reality to provide psychosocial support to populations in the midst of all these crises. We're seeing things like 3D printing in war environments to help build prosthetics, lots of information and analysis in terms of anticipatory actions with weather and other patterns. So it's really important that we really break this down and give people access information and the tools to know how to use it ethically.
Well, you have one of the most interesting partnerships that I was very, very impressed with. It's a partnership with Cisco. Technology for Impact is what I understand it's being called, and it's delivering aid and development assistance people faster and more effectively. And this stunned me. It is already providing 13 million people in 45 countries digital solutions. That is what I would call a successful partnership already started. Yes, that is worth an applause. Tell us about it. How is it working? What is it doing?
Yeah, I think for our tech partners in the room, the most important thing to note about the Cisco partnership is it's one we developed in 2017 with a 5-year commitment. And that long-term commitment and partnership really allowed us to iterate, to test, to fail, to make things better, which is so important in terms of innovation and uses in technology. The goal of that is to help us do things faster and better. So a couple things, and remember this started in 2017.
You were really ahead of the game.
So prior to the Cisco partnership, all of our data collection that we were doing in programs in countries where we work was mostly manual. The Cisco partnership allowed us to digitize all that. So especially for monitoring and evaluation for learning, the digitization in low connectivity environments, so that's also where it helped, has enabled us to then also bring tools like data analytics and advanced analysis to that work that's allowing us to adapt programs real time, seeing what's working and what's not working, and allowing us to use all those analytical tools real time instead of having reams of paper that we're then kind of putting in and out of things. Another work that we're doing with Cisco right now is in northern Kenya with some local governments in northern Kenya to help them reach pastoralist populations, which are historically underserved. So we've been working with Cisco to train those governments on how to look at geospatial analysis and weather data to help pastoralists understand the shocks that are ahead of them. So it's been transformational.
Amazing. All right, the last futuristic question, which is last year was halfway to the 2030 SDG goals. We are totally off track. At best, 12%, maybe 15% on the different markers. Is there any hope, I asked this to one of the other guests, but is there any hope that technology, AI, Jada, for the you who don't know, is one of the premier development experts in the world. Is there any hope that technology and AI can supercharge this so we might be able to get there by 2030, or at least get better than we are?
It's going to take a lot of us to get there by 2030. But for us, we see the biggest step change and the biggest potential in the idea of anticipatory action, particularly with climate shocks and climate change. So being able to leverage technology, especially data science and that fusion of big data, to really do things in advance to help populations be more resilient. So 2 examples I'd like to share. One, we have thresholds for hurricane analysis and other things, and we were able to work with one of our partners, Remitly, which helps with remittances. And when we saw hurricanes coming in Guatemala in 2022, we were able to waive fees and use the Remitly base to reach out to people that were sending remittances to Guatemala to say, hey, you might want to send funds now, and here's some waived fees if you want to send more to help your families and your loved ones cope with this pending hurricane. So there are all kinds of examples like that where you're kind of able to see something ahead and help people ahead of time before they're in the worst of situations.
Well, as Chairman Brown gave us a challenge, learn something better each day, I think we've learned 5 things better each day. And thank you, Jada. Thank you, Greg, for helping us learn about this.
Thank you.